oriented. This is demonstrated when a clinician offers you a sheet of exercises without observing your response to those exercises. Okay, so if you've ever gotten, here, try these exercises, and the doctor hands you a sheet that looks like it's from the 1980s on a Xerox machine, or if you've ever been in a large physical therapy, I've heard this from many patients, some place where there's multiple patients, and you're seeing people there for multiple different reasons, but they all seem to almost merge together doing the same exercises. It's also sometimes an indication that there's a bit of a cookbook effect going on there. And so we have to be careful about that. Patients with any condition, you put your condition in there, retrolisthesis or osteoarthritis or degenerative disc, patients with any condition are not all the same. And we wouldn't be surprised about this if we talked about patients receiving medication. A patient who's 250 pounds heavier than another would get a different dosage. That's reasonable. Two patients, one that's allergic to one drug and one that's not, well, the one that's not might get that medication, of course, but the other one wouldn't. One patient with a conflicting comorbidity, so another health problem that would be detrimentally affected by the medication, they would not get that medication, but someone else who didn't have that comorbidity would get the medication. Patients with a mild case of a disease, they wouldn't get the same potency of a drug that someone else who has a severe case. Different conditions share some symptoms, and so exercise, movement, physical therapy, whatever it is that you're doing to move, those also need to be tremendously individualized for each patient differently. So people with specific problems need the right treatment at the right time.